Well, I think ozone's a great modality in substituting for chronic antibiotics.
Mm,
Most of my patients have been on the antibiotics for 6 months or even 2 years intermittently. Either they developed a lot of resistance to the antibiotics, and it's just encouraging, I think, the spirochetes to stay in those round body forms. And then we have to really get at those.
right.
And we don't have the consequences of being on multiple rounds of antibiotics.
Hi, and welcome to the LymeBytes podcast, where we shine a light on the misunderstood science of Lyme and other vector borne diseases, as well as the truths that many still miss. I'm Dr. Mariah Hinchy, naturopathic physician and fellow of the Medical Academy of Pediatric Special Needs. I specialize in treating chronic Lyme disease as well as other complex inflammatory conditions. In this podcast, we break down what's working and what's not. We share the facts that most people miss, we challenge outdated thinking, and we give both patients and practitioners the tools to heal smarter. So let's get into it and change the way we heal Lyme.
Welcome back to LymeBytes, rebuilding immunity, reversing inflammation, and redefining recovery. Today, we're diving into a powerful conversation about adjunctive therapies that can enhance recovery from Lyme and other complex chronic illnesses. Tools that go way beyond the basics to help patients break through healing plateaus. Joining me is Dr. Lisa Zimmerman, an integrative MD and the founder of Zimmerman Modern Wellness in Morganville, New Jersey. Originally trained in internal medicine, Dr. Zimmerman's career took a transformative turn when her daughter became seriously ill with Lyme, mold toxicity, and co-infections. That experience reshaped her approach to medicine and ignited her passion for solving complex chronic illnesses. With over 15 years of clinical experience, Dr. Zimmerman has developed biologically compatible protocols and trained in a wide range of advanced therapies, including ozone, eBOO, and PK membrane therapy, and more. In today's episode, we'll explore the power of these therapies and how they can accelerate recovery and help even the most treatment-resistant patients regain wellness. This is LymeBytes. Let true healing begin. Welcome, Dr. Zimmerman. Take a minute and share with the audience why it is you do what you do.
Well, I think it all started, as you said, that my daughter got very sick at the age of 13. Conventional medicine really couldn't diagnose her well. And when they did diagnose her, we didn't have good treatment protocols that really helped her. She
Yeah.
started with traditional antibiotic therapy and it really did not work for her. There was a lot of pieces of the puzzle they missed. They missed the mold-based illness and a lot of other pieces. So I had to go on this journey to educate so I could get her better.
Yeah. And then how did that, so I mean, I understand as a mom, as a doctor, with a child who has this type of illness, but how did that actually transform the way you were looking at your patients? Did you start thinking about, oh my gosh, Mrs. Smith and Mr. Jones, and I wonder if, and
I
yeah,
would get someone who was chronic fatigue coming in my office, and I'm like, oh, I wonder if they have mold exposure illness or they have chronic Lyme, and led into me adding that into a general practice. And pretty soon I was like, I don't need to do blood pressure, diabetes. Someone else could do that.
right.
Let me just do tick-borne infections and chronic illness.
Right. And as I think anyone who is part of this field and those complex chronic illnesses,
Mhm.
it takes so much time just to specialize,
Right.
in that piece that, yeah, there's no time for blood pressure checks and, and
No,
all of those other
no, that's how
things.
we just completely revamp the whole practice.
Yeah. All right, so let's dive right in. So, what are your top three favorite adjunctive therapies for patients that have Lyme or other complex chronic illnesses, and why?
Right. So three that I think I use a lot is ozone therapy, eBOO therapy, and PK therapy. So those are my top three.
Okay, so let's go one at a time.
Mhm.
And for our listeners, let's break it down. So, let's start with ozone. Tell us what it is.
Right.
Physiologically, what does it do in the body, and how would it support one's recovery?
Right. So ozone therapy, ozone is a gas. It's O3. When we're using it most of the time in my practice will be autohemotherapy, where we're infusing it directly into your body. So we're going to extract some blood, ozonate it, put it back in a bag of saline and give it back to you. And what does that mean? What does that do? So when you're getting an ozonated red blood cell, it's creating a process where the red blood cells taking it up. And you're going to see that they create hydrogen peroxide molecules from this ozone. Now, if you look at your white blood cells, their function is to go in and kill off infection or reduce microbial load. White blood cells create hydrogen peroxide and ozone. We could see that. So I like to tell patients I'm giving you a big dose of what your white blood cells would do, and we're going to reduce the microbial load. If they have Lyme disease or Bartonella, it's going to reduce how many bacteria are in the system, as well as it has a lot of other effects. It's going to elicit immune stimulation. It's going to give you cytokine intermediaries like IL-2, IL-6, IL-8. TNF-alpha is going to be upregulated by the ozone, and these are going to promote your production of T cells. So a lot of people, their T cell production has been exhausted from having chronic Lyme disease for a long time. You'll see that when you check a T cell number or natural killer count, it's going to be low in your chronic Lyme disease patient. But the ozone is going to elicit a little bit of a response to upregulate that again. So I'm going to get the immune system kind of fired up about your illness again. That's something we track in the practice is your natural killer T cell count, and ozone therapy can improve that as well. And then I think the third thing that ozone will do is it's going to activate your NRF2 pathway. And that's going to increase the production of your antioxidant enzymes. And then that in turn is also going to help you upregulate your antioxidant pathways and help you have some more healing. So again, 3 arms. We're going to reduce the microbial load, increase your antioxidant ability, and help your T cell production. So it's a great tool with someone who comes in who's been chronically ill.
Are you ready to revolutionize your approach to diagnosing and healing complex chronic inflammatory illnesses in both adults and children? The LymeBytes Symposium is your gateway to cutting-edge education, groundbreaking research, and innovative therapeutic solutions. Join us at the 2025 LymeBytes Symposium, November 14th and 15th at the Fort Lauderdale Marriott, Pompano Beach Resort and Spa. LymeBytes is the premier functional medicine conference on complex, chronic, infection-driven inflammatory illnesses. This year's meeting is jam-packed with leading industry experts discussing long COVID, mycotoxin illness, PANS/PANDAS, as well as Lyme and other vector-borne diseases. This conference will arm you with the knowledge, clinical pearls, and practical solutions that you can implement immediately into your practice Monday morning that will literally change your patients' lives and get them on their path to true healing. So join us at Pompano Beach or virtually from anywhere. Register now at lymebytes.com. That's LymeBytes.com.
Absolutely. And it addresses 3 different branches of, the treatment approach. So you talked about doing IV ozone. So, ozone through an IV needle into the bloodstream. Do you use other routes of administration as well? Like, do you do, from a nasal cannula, or do you, infuse it into water and have people drink it? Do you do rectal administration? Do you think any of those routes of administration have any benefit?
Right. So we do nasal ozone sometimes. They'll couple it. Some people do both. I find it beneficial. Some people, it's another little boost to the ozone treatment, or if they have some ear, nose, and throat issues, it might help the sinuses. Maybe we think it breaks down biofilm in the nasal passages as well, especially if you've been exposed to mold or mycotoxins, it might be useful. I don't really delve into the rectal ozone, but it is useful in some arenas to do rectal ozone. And I think it's a good way to absorb ozone into your system if you don't have access to intravenous, or you're dealing with the microbiome a little bit more. But I don't offer that in the clinic at the moment.
Okay, wonderful. And then anything else you'd like to say about ozone before we move on to eBOO?
Well, I think ozone's a great modality in substituting for chronic antibiotics.
Mm,
Most of my patients have been on the antibiotics for 6 months or even 2 years intermittently. Either they developed a lot of resistance to the antibiotics, and it's just encouraging, I think, the spirochetes to stay in those round body forms. And then we have to really get at those.
right.
And we don't have the consequences of being on multiple rounds of antibiotics.
Do you know how doing IV ozone impacts the microbiome?
I'm not sure, but I think it will upregulate the species that you're supposed to have in the microbiome. It'll upregulate their production. I don't know the mechanism.
Okay. Just I'm thinking from an antimicrobial perspective, and I have no idea what the answer is to this. I'm truly asking, would
Mhm.
it damage the microbiome to any extent like antibiotics do?
Oh, no, I don't think it does. I do a lot of GI map testing on patients
Yeah,
pretty much on their first visit. I will check it periodically, and I haven't seen that to happen.
that's great. So that's a really great way to get the same effect as an antibiotic,
Right.
but not damage the microbiome, which obviously
Right,
is
but it's
important for
tolerated
managing.
for long periods of time. If I give you ozone therapy every couple of weeks for even a year, I don't see any damage.
Great. Wonderful. Okay. So tell us about eBOO.
So eBOO is something that I've started in the practice pretty recently. And I think you're getting pretty the equivalent of a 10 pass ozone, which a lot of people are more familiar with, where you're getting a large quantity of ozone absorption and the UVB light. And they have a filter. Now, they don't like us to really quote, call it a dialysis filter, but it looks like one where
Mm-hmm.
the blood is going to pass through this filter and you'll see exudate come out. Now, we don't know what's in that exudate. I don't think it's been tested where we could tell you what's coming off of the cellular exudate as it passes through the filter. But I do notice that people who have had mold exposure get a certain type of exudate, and other people who only have tick-borne infections get a different color exudate. So it seems to be filtering off perhaps some of the harmful substances that have accumulated over the years when they're having the Lyme disease.
And
So
nobody's tested it to see what it
I
is.
spoke
That's
to the
interesting.
company and they said they couldn't find a company that would test that liquid, that exudate, because it's not a bodily fluid. It's not like sending in a urine sample or sending in a smear. So they couldn't
Right.
get a company that would test it for them.
Huh. Interesting.
So,
Now I want to know what it is.
right. But I notice when I do certain patients, when I have a heavily mold exposed patient, it actually comes out like a foam. In
Wow.
other people, it's a gray liquid. So I know it's definitely taken off different toxicants,
Yeah.
but I can't tell you what they are. And
Huh.
that combined with a high dose of ozone, most of my patients might have a Herxheimer reaction, but I try not to add that in the beginning when I think they have a high microbial load. I might first use regular ozone therapy and maybe even some herbals to decrease the microbes and then use the eBOO a little later. Unless they're just a mycotoxin patient, then they could jump right in.
Right. So, in general, the distinction, I mean, obviously there's a lot of distinctions, but the biggest thing to take home about eBOO is that if you're doing the high doses of ozone, you're getting it as an antimicrobial. And obviously,
Right.
you're getting all of the other benefits that you talked about with ozone,
Mhm.
with the antioxidant effects.
Right.
But then you're also filtering out a lot of the debris. And
Right.
sometimes that could be,
Making them
genetic material or fragments of old dead bacteria,
right.
as well as
Biofilm.
biofilm, mycotoxins,
Right.
things like that.
And some people who I think they're pretty much very close to remission on their tick-borne illness, but they're still chronically tired. Maybe they're pretty toxic. That makes the difference. We do some eBOO.
Okay. And then let's talk about PK therapy.
Right. So PK, I learned this from Dr. Prakane. She's the famous person who discovered how healing giving phosphatidylcholine is.
Right.
Now, you could do it orally, but if you do it intravenously, you're really going to get a better effect with a quicker timeline. And you can really boost that phosphatidylcholine coating on every cell membrane. You have the phospholipid membrane. So what I truly think happens during a chronic tick-borne illness or even mycotoxins is the phosphatidylcholine cell membrane gets injured. It gets pits, and in those pits you might see the very long lipid rafts. And then the membrane itself doesn't function well, can't carry a charge. People develop numbness or tingling. So that might be a more neurological symptom of that phosphatidylcholine membrane being affected. So I think if we replete the membrane by giving intravenous phosphatidylcholine, we're going to resolve some of the symptoms and help the cell to work better. It'll even repair the membranes of your mitochondria so that the little cristae work better, and you'll get more energy and healing. And she found that too. Dr. Kane used it quite a bit. I think she used it a lot in patients even without chronic tick-borne who had membrane diseases like MS.
Right. And I mean, how important do you think it is? And do you do this in your practice? Do you have patients try to avoid toxic oils that are inflammatory, seed
Yes,
oils, things like that, right? Because
absolutely.
a lot of times the phospholipid membrane
Right,
not only doesn't have enough, choline and serine and the phospholipids, but
right.
also it ends up with all of these inflammatory lipids that make the
Absolutely.
situation worse and stiff.
So every person in the practice really has to be, every patient is taught the proper diet.
That's
Where things to
huge.
eliminate, things to really include. Those are all things we work with them. Now, whether they all do it 100% is a different matter, but
Yeah.
we try to work with them with that.
Yeah. And I think education is key because I think, most patients, at least most of my patients, are really willing, to do whatever they can to get better. But,
Right.
we're given so much terrible information in this country about diet and
Sure.
nutrition and what we should be eating. So I love that you do that educational
Yes.
piece with your patients, whether they take your advice or not. I think just that
Most of
education is
them
so
do.
powerful.
And I always tell them, I'm doing everything I'm asking you to do. I've
Yeah.
done it and I do it every day in my diet,
Yep.
and it can be done.
Yeah, it absolutely can be done.
Right.
Okay. So, do you want to elaborate a little bit deeper about the importance of the phospholipid membrane and what using phosphatidylcholine does from a more physiological perspective, like what the benefit is to restoring the phospholipid membrane?
Right. So I think the phospholipids on the top of the cell membrane is what carries the ionic charge. It helps it to function. And especially in the nervous system, you can get, I like to call it like a short, like if you had an electrical wire and you don't have the covering on it, people are getting these neurological symptoms, whether it's numbness, tingling, brain fog. A lot of neurological symptoms are due to that phospholipid membrane not functioning, not repaired. And if I give the PK, they see the cognitive benefit. They get rid of some of the symptoms. So I think it's a big piece of the puzzle.
Are you suffering from Lyme disease or another complex chronic illness and aren't sure who to trust when it comes to herbal supplements? Hi, I'm Dr. Mariah Hinchy, founder of LymeCore Botanicals. As a naturopathic physician specializing in complex chronic infection-driven illnesses like Lyme disease, I needed herbal medicine I could truly trust. That's why I formulated LymeCore Botanicals, where our herbal tinctures are handcrafted in small batches right here in Connecticut. We use the whole herb, never isolates, to preserve the full spectrum of medicinal compounds. Every single step from sourcing to extraction is done with precision to ensure maximum purity, potency, and consistency. These are the same herbal formulas I use to heal myself and have used for years to help my patients and family members heal too. And now I'm making them available to practitioners and patients everywhere. LymeCore Botanicals, herbal medicine you can trust from a doctor who lives this work. Learn more at LymeCore Botanicals, That's LymeCore.com.
Tell me, if you're doing the PK protocol, about how many sessions is it? How do you spread those sessions out? And when do patients start to see an improvement?
Right. So I usually recommend at least 6 to 8 sessions, if not 10.
Okay.
If I have someone who I would consider in a fragile spot, I might say if they could come twice a week for 4 weeks, we'll start with that. Some patients are only able to come once a week. So I will recommend a protocol of about 8 sessions to begin with. Now, I've had a few patients. I had a young woman recently. She told me she had a lot of muscle rigidity of her neck and a lot of numbness, tingling in her upper neck and body. 2 PKs, and she said it was disappearing. So I've had
Wow.
people get a really good response early on, and I've had some people, they don't feel much different until 8 or 10 sessions. So I don't
Okay.
know if it's because of the level of damage, but it's variable.
So, would people that, for example, have a choline deficiency, like a dietary choline deficiency, and let's say you can see that, on a cellular test for this nutrient,
Right.
would you see a different response for those people than you would for maybe someone that didn't have a nutritional choline deficiency? Or is it a matter of just you're giving it at such a high dose, IV, that it's doing more than what you would just accumulate from your food?
Right. So I think, yes, it's such a high dose intravenously, whether you're choline deficient in the diet or nutritionally, it's still going to work quite effectively. I do ask them to take the PK capsules as well
Hmm.
so that they don't become deficient or we override the deficiency. But the IV is just such a high dose, I think we just counteract that.
And what do you think about the difference between taking orally, like phosphatidylcholine,
Right.
versus the alpha GP choline?
Right. I haven't really seen that I've used the alpha G so much, so I can't answer that. I usually always go to the phospholipid PC.
Okay.
That's what Dr. Patricia Kane pretty much trained me with.
Okay. All right. And so, from those three, if you
Uh-huh.
plan to do those three therapies with a particular patient, is there any order that's important?
So what I do is when the patient comes into the office, we're going to look at 3 different things. What is their infections? Do they have tick-borne infections and what are they? Then we're going to look at, do they have a toxin load? Do they have mycotoxins where they also have a toxic exposure? And then we're also going to look at the immune system. And we're going to look at the inflammatory state, CRP, C4A, TGF beta 1. So we're going to look at that patient. Let's say their inflammatory is low and they don't have mycotoxins. They only have, say, Lyme and Babesia. And then I'm going to jump into ozone therapy pretty quick. I don't have to worry about PK, I don't think, as much as someone who has a mycotoxin exposure and a high inflammatory state. Then I might be pushing the PK a lot sooner.
Okay.
So we're going to look at all those factors and see what kind of a patient are you and how is your reparative state.
And do you typically combine, and I don't mean simultaneously, but do
Right.
you typically combine, PK therapy with
Absolutely.
eBOO or ozone? It's not like you're picking one
No,
per
absolutely.
patient.
Let's say you have all 3 manifestations, right? We
Yep.
have an infection, we have mycotoxins, and we have high inflammatory state. So then basically you need to combine all of the modalities that we offer.
Right.
Yes.
Now, are these your main therapies for treatment, or are you also
Mhm.
doing like a main core protocols, so to speak, with either
Right.
antibiotics, herbs, nutrients, nutrition, lifestyle? Like what else does your
So
practice?
all patients get some nutrition, like we were saying, and some supplementation with nutraceuticals. They all also go on an herbal protocol. I'm a big believer in herbal botanicals to treat Lyme, Babesia bartonella, and even Epstein-Barr virus. I pretty much got away from antibiotics except for maybe a very short course if I think they needed it in the
Yeah.
beginning, but I really like the herbal protocols, and it's all combined into someone who's also getting ozone, PK, possibly eBOO. So it's
Okay.
all done together. You have a whole program.
Wonderful. So, how do these therapies enhance or accelerate that underlying treatment protocol that you were just referring to?
Right. So I do certainly have some patients come in and they don't take advantage of the intravenous side of the practice.
Yeah.
And they'll do the nutraceuticals and the herbals and the dietary guidance. And then I like to think that you're either a simple patient where you're not that inflamed and you had one or two things wrong and that worked really well, or we move you over into the IV room when it's not as effective as we would like. And then they really need the ozone therapy or the PK therapy to make that jump into wellness.
Okay. And aside from the part of eBOO where we're filtering, do you
Right.
use a lot of other detox methods with your patients?
Well, we do offer intravenous vitamin C,
Hmm.
and we ask them sometimes if they're mold exposed to do infrared sauna. We'll be adding in lymphatic massage pretty soon so that we can open up the lymphatics. And we do use some of the Picana remedies for
Yep.
detox as well. That's pretty much on everybody's protocol.
Great. So when you're using the ozone, the eBOO, where for those two would you say is the right time to introduce? Do you start out with these or do you wait till they're several months in?
Right.
Where do you feel is the right time to incorporate ozone and eBOO specifically?
Well, I tell my patients, if I had my choice when every patient walks in the door, I'd love to start ozone.
Okay.
I'd love to start them on even a small dose of intravenous ozone along with the herbal, along with the diet, because I
Yeah.
just find it's such a great addition. So if they're open to it and willing to start with that, I would start with it right off the bat.
And what about the PK therapy?
Now, again, PK therapy, I will probably add in if I thought there was more of a neurological component
Hmm.
or a toxin exposure.
But would you do that at the beginning? Would you do that several months in?
Depends
Or
on
does it
the
depend?
Depends on the case. I have no like standard, this is the protocol. I assess in the beginning, like I said, where you are as a patient. And some patients have been sick for 10 years and they're quite depleted. I might just start with PK and that's it.
Yeah, I
PK
was
and
going to ask.
nutraceuticals, those patients start very gently.
Yeah.
You could pretty much just see the patient coming in the wheelchair and they can't even lift their head up. They've had all these diseases and toxicants for so long. We're like, you're just a PK patient.
Yeah. I would imagine it very much helps to enhance the cell's ability to absorb the
Right.
various nutrients and therapies that you're using, right? Because if we have a very stiff, non pliable, non functioning cell membrane, it makes it
Right.
very, very hard to get anything into the cell.
Right. And we
Yeah,
don't want to really, I like to tell people we don't want to really go after the microbial load really aggressively until we prep the body.
exactly.
Right.
Okay, so for practitioners that are new to these tools, where do
Mm-hmm.
you suggest they begin? So, both in terms of just learning about these therapies, where can they find more information? And then also, how can they find out how to apply them clinically in their practices?
So, I mean, it took me a lot of different conferences to figure it out and develop your own way to make your protocols. I don't think there's any one conference you're going to go to
Yeah,
that's going to explain all of that, but there's certain oxidative therapy training centers to learn all about ozone, how to administrate it, how to dose it. eBOO has their own separate training through their company. When you buy an eBOO machine, they have a company that will also train you how to do it. And then, of course, I went to Patricia Kane's training for the PK therapy.
Right.
Unfortunately, there's not one place that you could just say, I want to learn everything. You have to kind of go to one, then do the next, get more interested and add something else.
Right. And I
Right.
mean, I've interviewed a lot of different Lyme physicians or
Mhm.
complex chronic illness physicians too. And a lot of them use Ozone or use eBOO. Some use PK protocol. It's
Right.
you're the first person that I've met that does all three together in one clinic,
Right.
along with
Mhm.
lifestyle medicine, herbal medicine. So it's really nice to
Well,
hear.
that's probably because, I got my daughter better and she needed a lot of modalities. And then I started using that in the clinic. And then I still had patients that didn't get better. So then I said, okay, let me learn something else, which eBOO was a recent addition. And then I'm always looking at here's this one patient that needs something else. So I added.
Right.
I don't like to give up too often.
Yeah, I know. It's hard. I'm the same
Mhm.
way. Okay, so what is the one tool or therapy that you think is underutilized in our field and has the potential to support recovery in really tough treatment resistant cases? If you could only pick one.
So if I could only pick, like if I had a clinic and I had to pick one thing.
Yeah. I know
So
it's a hard question.
it's a hard question because, like I said, there's different cases. If you have a lot of chronically ill people, like I said, where they're in a fragile state, I'd be picking PK. If I
Okay.
really wanted to, help the patient get over the microbial load of Lyme disease, Bartonella, I would be picking ozone. So it's hard to say, right?
Yeah. Right. And unfortunately, most patients are dealing with both of it. So,
Right. Right. And that's why I do offer all of them because otherwise I feel like I can only conquer one part of their problem.
right. Did you used to refer out to other physicians in the beginning for these therapies, or were you able to just when you went integrative for
I went integrative and had ozone and PK from the start.
Oh, that's
And I
wonderful.
just recently added eBOO.
And you said that was
Mhm.
15 your daughter got sick 15 years ago, correct?
Yes.
So you've been
Well,
doing this
she needed both ozone and PK, so I learned about the value of both of them,
that's
and then I
wonderful.
got trained and just started doing them.
Yeah. All right. Well, before we wrap up on this episode, is there anything else that you would like to share, just in general, regarding complex chronic illness or regarding the therapies that you've talked about today?
Well, I think, most of the doctors that are in this field, we're all in this field to get the patient better. And I don't, I think you have to go through the journey and you just have to say, I'm never going to give up.
Yeah.
I keep looking at new therapies every day. There's a couple more I'll be adding really soon. Because again, I don't.
Would you like to share that with us? What are you looking at?
So I just also recently started doing SOT therapy.
Okay.
That's phenomenal.
Why don't you tell our listeners a little bit more about that? That's something that we've not yet talked about on this podcast. So if you'd like to be the person that introduces it.
So maybe 2.5 years ago, I started reading about SOT, which is single oligonucleotide therapy.
Mhm.
And the concept is you're going to take the patient's blood sample, ship it to the lab in Greece. They're going to get the genetic code of the nucleotides of, say, your Lyme disease species, design a single oligonucleotide that's a mirror opposite. They're going to send me back those little proteins in a vial, and I'm going to infuse it. Those little proteins are going to search out its mirror opposite, which is the spirochete, insert itself, and it'll be demised. Then it'll go to the next spirochete, insert it, and we'll see that it effectively eliminates quite a few Borrelia over a 4 to 5 month period of time from one infusion.
That's amazing.
So it does really amazing things. Now you do have to know how to sequence it. And I'm really careful not to start with SOT. Like I said, get the body ready, get the patient ready. And then we look at if we can use something like that to shorten up the course of therapy to lessen how much spirochete's there, or Bartonella, Babesia. They have Epstein-Barr doses. You could do viral loads. It's quite exciting. I have a lot of patients who were like halfway better. I give them a dose of SOT, and 2 months later, they're telling me, I feel great. So
That's
it's
amazing.
changed the practice a lot.
Yeah,
So
I've been
that's
looking
another
a
thing.
lot into SOT recently too.
Yeah,
What's the other one? There was another one you were looking into.
right. So the next thing I'm probably bringing in shortly is going to be True Dose. I
Oh,
think you're familiar with
wonderful.
that,
I'm so familiar with them. Yes.
right?
Trudeau's is amazing. I've done it myself 4 times, I think, in the past
Yeah, it looks
year.
amazing. I've been reading up on it. Mm,
Yes, and Trudeau's is our platinum sponsor for the LymeBytes Symposium, so
yes.
they will
My
be
office
there.
manager already talked to them, and we're pretty sure we're adding that in
That's
shortly.
great.
So now I'll have pretty much any therapy that you're going to need, and we'll just have to sequence them and see who needs which one.
Oh, that's wonderful.
So it's going to be exciting,
That's so exciting. We'll have to have you
right?
back on to talk more about SOT and
Well, I
about
would love
Trudeau's
to.
as well.
I would love to have a couple of patients who really just turn them around with the SOT therapy.
Yeah. Great. Any final words of wisdom you'd like to share with our listeners?
I guess never give up and keep researching. And I learn from my patients as well. They send me
Mhm.
articles, they ask me questions, they challenge me, and I'm here to help them.
Yeah. We learn from our patients every day. I think I've learned
Right,
just as much from my patients as I have from any book or lecture or seminar, etc.
right. And I'm always willing to listen. And I think most of us that are in this space are that kind of physician.
Yeah. I mean, we have to.
Mm-hmm.
We have to for
You
so many reasons.
have to write it down or give them instructions because they're going to forget.
Yes, that's true.
Right.
Yeah. Sometimes I think just the validation of being heard, and feeling like you
Yes.
finally have somebody who's listening to you and believes you
Many.
and doesn't think you're crazy.
Yes. On that first visit, many patients start crying
Yeah.
because you're listening to them and you get it.
Yeah. Yeah. Well, especially with you having a daughter who's been through it, and I
Right.
myself have been through it. And I think, I would say 95,
Of one.
if I had to guess, of practitioners who specialize
Yes.
in
Someone in
complex
the family.
chronic, yes, they have either themselves or a very
Mhm.
close loved one who they've pretty much had to save from these
Well,
things.
she would have never gotten better, I don't think, with anything conventional medicine
Yeah.
could have done for her.
Yeah.
Right.
Well, thank you, Dr. Zimmerman, so much for
You're
joining me
welcome. It
today.
was
And to
wonderful.
all of you at home, thank you for listening to Lyme Bites. We hope this brought you one step closer to true healing. If it helped you, share with someone who needs to hear this too, because together we all heal stronger.
It's great. Thank you.
If this episode gave you an answer, brought you new insight, or made you think differently, subscribe to the LymeBytes podcast and share with someone who's ready to take control of their healing journey. And if you can, please leave a review. It helps others to find the show. Thanks for listening, and we'll see you next time.